For this procedure, the RN will need normal saline flushes, the pre-filled medication to be administered, the carboject, alcohol swabs, non-sterile gloves, a drug reference manual, the MAR, and the patient's chart. To begin, the RN verifies his order, checking that the indication for the IV push medication makes it the appropriate route. He then reviews the medication reference information. If administering through an existing IV line, he would verify the compatibility of the medication with the IV fluids and prepare it according to the 10 rights. He then performs hand hygiene. To prepare the medication, twist the base of the carboject to the left to unlock it. Pull down on the plunger and insert the pre-filled medication so that the medication label is visible. Then twist the base of the carboject to the right to lock the syringe in place. The RN enters the room and performs hand hygiene. He identifies the patient using 2 patient identifiers, explains the purpose of the medication, side effects, and that the medication will be administered through the existing saline lock. He applies non-sterile gloves and inspects the IV site for redness, swelling, edema, pain, discomfort, or dislodgement. He then takes 3 alcohol pads and cleanses the saline port. He attaches the normal saline flush, unclamps the lock, aspirates for blood, and pushes the saline into the catheter. The RN then takes his pre-filled medication syringe and directly attaches the medication syringe into the saline lock. He pushes the medication at an identified rate, cleanses the port, and attaches another saline flush to the catheter, pushing it at the same rate as he pushed the prior medication. He then removes the syringe and clamps the saline lock closed. He also checks the patient's response. The RN then disposes of his syringes in the appropriate containers, removes his gloves, and performs hand hygiene. He then documents the medication administration into the MAR.